A serious complication of acute type A aortic dissection, or ATAAD, is acute kidney injury. In this study, the authors investigated whether early initiation of renal replacement therapy, or RRT, in such patients could reduce 90-day mortality and improve clinical outcomes. The study included 212 adults with acute kidney injury following ATAAD surgery at Beijing Anzhen Hospital. The patients were randomized into two groups. In the early RRT group, RRT was initiated within 6 hours of diagnosis of stage 2 acute kidney injury. In the standard treatment group, RRT was initiated within 8 hours of diagnosis of stage 3 acute kidney injury, or if any of the absolute indications for RRT were present. The RRT included continuous veno-venous hemodiafiltration. The study showed that early initiation of RRT resulted in lower 90-day mortality. Early RRT also resulted in lower in-hospital mortality, 30-day mortality, and median duration of RRT. The two groups did not show significant differences in the incidence of organ dysfunction or the intensive care unit and hospital lengths of stay. Lactate clearance was higher after 6 and 12 hours of RRT in the early RRT group than in the standard treatment group. After 24 hours of RRT, interleukin-6 and interleukin-18 concentrations were significantly reduced in the early RRT group. In summary, early initiation of RRT in ATAAD patients with acute kidney injury is more effective in reducing mortality compared with the standard treatment. Decrease in plasma inflammatory factors in the early RRT strategy may explain the reduced mortality.